Welcome. My name is Dr. Meghan Davis. I'm the director of the Johns Hopkins Poe Center, which stands for Psychosocial, Organizational, and Environmental Dimensions of Total Worker Health. Today, we're going to talk about total worker health, and let me give you an introduction. The Total Worker Health Program was launched in the United States by the National Institute of Occupational Safety and Health, otherwise known as NIOSH, over a 10-year period between about 2005 and 2015, with a goal to promote worker health, safety, and well-being. Total worker health is a holistic approach to integrate worker health promotion with occupational safety activities. And in this, some of the attention is paid to improve worker physical and psychological health outcomes, which we might term worker outcomes, as well as focus on organizational outcomes, where a goal is to reduce the impact and potentially the economic burden to organizations that derive from worker injury and illness. If we look closer at worker outcomes, there may be quite a few different dimensions that we might consider. There can be physical health measures, such as blood pressure or sleep quality, that can influence both physical and psychological health. We may focus specifically on mental health and well-being outcomes. And in this, we use the definition by the World Health Organization that mental health is a state of mental well-being that enables people to cope with the stresses of life, to realize their abilities, to learn well and work well, and contribute to their communities. When we think about negative mental health or well-being outcomes or conditions, we might think about things such as depression and anxiety, or challenges such as substance use. With worker outcomes, we also think about illnesses, which can be either acute, meaning something that happens quite quickly, like an infection with influenza or SARS-CoV-2, or we might think about chronic disease outcomes, which can include things like diabetes and cardiovascular disease. Finally, injury and musculoskeletal disorders are often a concern at workplaces, in part because of the kinds of exposures that workers may have related to their job activities. This can include things like needle sticks, falls, or repetitive strain injury. In addition to worker outcomes, we also want to consider organizational outcomes. These are measures that may relate to the enterprise itself, which could be the employer or other institute or organization that manages a workforce. In these, there are a number of different dimensions to consider. Some of them relate to whether or not employees are being productive at work. This can include presenteeism, which is time spent at work with reduced productivity, potentially related to worker illness or other reasons. So, for example, if I came to work sick, maybe I would not be as productive as if I, had not been ill. With absenteeism, this is time off work related to worker or family illness or other reasons. Turnover is another important outcome. This is the frequency with which workers leave an organization and are replaced. This can be voluntary, where it's the employee's choice to leave and that work function is replaced with a new employee, or it can be involuntary, where it's the employer's choice. Finally, there are additional outcomes related to the economic bottom line of an industry, which can include the healthcare costs for the benefits that are provided to the workers. And also product quality and quantity. This doesn't just have to be in terms of, for example, widgets, right, that are created by workers, products that they make. It can also refer to things like patient safety and patient satisfaction, for example, in a healthcare setting. What total worker health does that is a little bit different than what has previously happened in occupational health and safety is that it really tries to integrate health protection activities, so what you might consider to be traditional occupational safety and health functions, with health promotion activities. These are typically individual level interventions to improve health. Within worker and workforce interventions, traditional occupational health and safety controls often focus on reducing exposure to hazards. This could mean a range of activities related to exposure to toxic chemicals, exposure to infectious agents, exposure to physical hazards, and the various measures in terms of engineering, administrative, and other controls that might reduce the exposure and improve the safety of the workplace. In total worker health, worker interventions also include initiatives to improve physical health, such as attention to reduce sitting and increase physical activity, programs to encourage weight loss or reduce use or dependence on tobacco. Could also include encouragement of healthier diet or access to healthy dietary choices. And other worker interventions may focus on stress management. With total worker health, it's also important to consider organizational interventions, and there are quite a variety that may be used. These can include attention to administrative controls, such as trying to standardize shift schedules or pay attention to workers who may have floating or challenging shifts, and also consideration of workload. For example, healthcare worker to patient ratios may be an area for improvement. The culture of work is quite important in total worker health. And this relates to not just supervisor support, but also support within a team from one peer to another. This can sometimes be operationalized through, for example, champion programs or other peer support networks. Consideration of worker autonomy is also very important to the culture of work. And so giving flexibility and the ability for workers to make some of the decisions about how they work can help to improve their satisfaction on the job. Finally, and quite critically, supportive leadership is essential for organizations to improve workforce well-being. Supportive leadership may include communication from leadership in terms of concern, support, or empathy to their workforce. Investment in and dedication to helping employees access resources they may need for their own physical and psychosocial health. And sometimes even participatory approaches to decision-making, including teams in terms of their input into decisions that might advance the mission of the organization or workforce. Finally, the environment is a critical piece of the workplace, and there are quite a few different examples of environmental interventions. Engineering to reduce exposure to hazards, and this can include things like using remote technology in order to accomplish particularly hazardous tasks, or consideration of ventilation controls to move any airborne exposures away from the breathing zone of the worker are pretty classic in terms of occupational safety and health approaches. With total worker health, there may be additional attention paid to ergonomic design to try to reduce or prevent repetitive stress injuries or other challenges that may come from the way people work and how they interact with their workplace, as well as improved access to opportunities to have a healthier lifestyle, which could include on-site gyms or other active transport options if the industry has a larger campus. Finally, some industries will consider with a new building to try to get WELL certification, where the building design is specifically focusing on improving the quality of air and water for the employees, mitigating their exposure to other hazards, encouraging movement or allowing it, and boosting cognitive well-being through a number of different functions. This can include attention paid to temperature or light or noise, and allow employees to make decisions around what workplace environment is going to help them do their job best. In occupational safety and health, there's a concept called the hierarchy of controls. It's a framework that aids in determination of more effective interventions in the workplace. When it's applied in an occupational safety and health context, elimination of hazards is considered to be the most effective, and attention to personal decisions or personal compliance is considered to be the least effective. And so in traditional occupational safety and health, you might say use of personal protective equipment may be the least effective, but potentially quite important or useful for worker safety and health. Administrative controls may be considered slightly more effective. Engineering controls, such as ventilation, to remove exposure to the hazard would be in the middle. And then substitution or elimination of the hazard itself would be considered to be the most effective. If we apply this to total worker health, as shown in the figure, you see that elimination could include taking negative working conditions and removing them, or addressing barriers to safety or well-being would be considered examples of elimination and the most effective. Substitution could be through workplace policies, processes, and practices that would improve safety and health. Instead of engineering controls, we may consider design, so the work site design for healthier, more productive working conditions. Instead of administrative controls, we may focus on education and try to give employees and supervisors resources for improved knowledge. And finally, we might encourage adoption of healthier practices. In total worker health, there are a number of partner groups, what some people may refer to as stakeholders. The ones that are classically within the occupational safety and health realm are, in the United States at least, two separate agencies. OSHA, which is the Occupational Safety and Health Administration, that promulgates workplace safety and health standards and focuses on the regulatory side, and NIOSH, the National Institute of Occupational Safety and Health, that focuses more on expertise, research, and translation to practice. There also are quite a few professional societies and a lot of academics who are engaged in this work. These can include traditional occupational safety and health societies, for example, the American Industrial Hygiene Association, societies focused specifically on total worker health, as well as psychology associations, including the Society for Occupational Health Psychology and the Society for Industrial and Organizational Psychology. Within industry partners, those who work in human resources or manage employee assistance programs designed to try to improve access to benefits for the workforce often are the ones most engaged in total worker health. Occupational health psychology is a field dedicated to the application of psychology to protect worker health and promote well-being, and is one of the major groups who are engaged in total worker health activities. What's important to recognize is that occupational health psychology is in and of itself a field that is interdisciplinary, and it really requires bringing together expertise between those who work on psychological health and those who work on occupational health. Occupational health psychology really tries to do primary prevention, meaning trying to reduce exposure to the risk factors that can drive stress, illness, and injury at work. And it is related to industrial and organizational psychology, and both fields may be involved. And IO psychology is the application of individual, group, and organizational behavior change to the workplace. So what makes total worker health different from traditional occupational health and safety is, first and foremost, its holistic approach. This is a recognition of the importance of systems and system dynamics, how these elements are interconnected. And so you don't simply think about trying to prevent needle sticks. You might think about the entire environment that surrounds that, the behaviors that may drive needle stick injury, the impact of needle stick injury on a worker's well-being, and the various ways that you can use that to help prevent the problem in the first place. It is a field that engages multiple disciplines, and it might help if I give a few definitions. We may work in a multidisciplinary way where we have people from organizations from separate disciplines working independently on the same challenge, project, or program. In total worker health, there really is a drive to make this more inter or transdisciplinary. Interdisciplinary is defined as people and organizations from separate disciplines who coordinate to address the same challenge, project, or program instead of working independently. But in a transdisciplinary approach, you bring together experts to co-design, conduct, analyze, and interpret the data from projects or programs, or to work to transcend these boundaries in the activities that may address a shared challenge or goal. Ideally, total worker health really tries to drive participatory approaches in which workers are engaged to help to do some of the design and to take part in some of the ranking of the challenges that may need to be addressed.